Okay, welcome everybody to the final session. It's quite sad, but all good things do eventually come to an end. So I will get started. It shouldn't take too long with this chapter. It's really a summary of some of the other things that we've been covering, some of the other concepts, and looking at key data sources. So looking around using some of the information about health metrics from previous chapters and how you can look at variation across different kinds of countries or continents, and the way different countries are classified according to sustainable development. If your work is kind of international or anything like that, it can be really useful to understand how things can vary and some of the factors as to why those things might exist. And also looking at the Global Burden of Disease study, which is an absolutely phenomenal resource for all sorts of amazing reasons. There's just so much rich information, and I love the data visualizations. I get very excited about the visualizations on the site because you could easily get lost for hours just exploring data, and all the visualizations they have. And thinking about health metrics for public health policy. And I think it's relevant whether you're working at a global level or a national level or just a very local place-based approach. It's really interesting and useful to understand how policies are shaped by some of these data, and having a look at specific examples of interventions. So, as I mentioned, the key data sources for this session that are described in the book are the OECD's Health at a Glance data and the Global Burden of Disease data. So looking first at the OECD Health Data at a Glance, I'm just going to reduce this so we can have a look. Are you still able to see the OECD screen? Good, okay. So this is just a sample of a data set that you can access. There's a really powerful data explorer on the site where you can filter so time periods, for example, to refine your selections, reference areas, geographies, different kinds of measures that you want to look at. So the example here is I've picked mortality, morbidity, welfare cost from exposure to environment-related risks. And there's a summary of what you're looking at, dailies at the top, units of measure per 1,000 inhabitants, and ambient particulate matter. You can download the data set or you can use an API, and they're really useful if you want to go back and keep collecting data and you want to automate some of that collection process. When data are updated, you can set your API, and we'll look at an API in a moment. But I think what's really nice is as well, there's a lot of information about the data sources and how the metrics have been calculated, how the statistics have been derived, and the information that's gone into that. And there's a nice bit of documentation about the data. So it really is a fantastic resource for finding data and understanding it, good metadata as well. So heading back over to our code. So looking at disability adjusted life years due to ambient particulate matter as a risk exposure, which is something that I've contributed to in my current role as well, looking at particularly PM 2.5 in streets around schools and what happens when we stop cars for periods going down those streets and how that reduces PM 2.5, which is a really damaging pollutant, gets into the lungs and it can cause all kinds of problems with asthma, breathing, and so on. But also recently been linked to poor mental health as well. There are some correlations that need to be explored around that. So the packages, these are the main packages. The RSDMX is an R version of a package that allows an interface to a statistical data, metadata exchange, which are technical standards designed to describe statistical data, and metadata normalize exchange between organizations and improves efficient sharing of statistics. So it's a standard kind of format. And from the OECD website, this is the URL. Read the data. I haven't run it in the slides because it starts wanting to process information, which is not what I want. So this is what you get. Reference area, which is the country, and there's a nice package, country code package, that you can use to change these 3-letter codes, these ISO type codes, into country names. And you can see that's dailies, PM 2.5, the time period and the value. Filtering out the bits and bobs you don't want, all the different geographies you don't want, and then using the country code package here to change the 3-letter codes into actual country names. And then you can filter out whichever countries you like from that. And the geom-text path package, I really like. It's a really nice package. It really does make labeling things like line charts in particular quite easy. If you want to take away a legend and add a label directly to a line, it can improve the readability and reduce cognitive load for people who want to look at a chart and interact with the information, but having to scrutinize legends and look at writing. So I think the function, the geometry label line, is really, really nice, and you can modify the parameters to get the positioning where you want it to be, and it can look quite attractive. This is just a basic one that I did, just a black and white version, and it's a really nice thing for the back row, as I call it, for people who maybe sitting a bit further away, or perhaps their eyesight might not be, as you get older, contrast declines and so forth. So I think what that can show is, obviously, with the data, that Egypt has a higher rate of disability associated with particulate matter, high concentrations of particulate matter, which has declined over time. Morocco appears to have increased. But you can see already with the example of using OEC data, how you can refine it and modify it with just a few bits of code, really, and create a very simple but informative story around the data sets that are available, which is, I think, really incredibly useful. And the fact that it's free is really impressive. So I'm going to have a look at GBD data now. I really, really love GBD tool. I could spend quite a lot of time looking at the GBD data. And I think you can see the GBD, the main website. It's really quite lovely. But I just want to quickly look at the VizHub, which is just brilliant. So I'll look at the basic settings first. So you can see this is a tree map, and they're kind of very broad categories: non-communicable diseases, communicable maternal, neonatal, and nutritional diseases, and then injuries. So this has categorized various diseases into these main groups, and there is documentation that describes the rationale for how and why. If you want to get a more granular look, so you can see there are kind of, you can cause and risk, you can look at different measures and different geographies and years and so on, but you go to the advanced settings and you can increase the granularity of these categories. So you can really start to dig in. This is at a global level, but you can pick different geographies of whatever you want. And you can start to see how each of these main categories break down into these nested groups, to see which factors. And on the hover, if you can see the hover box, when you look at particular conditions, it shows the percentage of how much that particular condition might contribute to years lived with disability, for example, if that's the metric that you're looking at. So it does give an overview of general statistics. You can look at dailies. We've been talking a lot about dailies in this book, and other types of metric as well. There's prevalence, incidence, and deaths. So you can really customize and tailor. And I think this is just absolutely brilliant. I think it's built with D3. Data-driven documents, a JavaScript framework, which I absolutely love in terms of the powerfulness of what you can do with visualizations and how you can really bring data to life and make it pop for different audiences. Bit tricky to learn. There are frameworks like Observable and VizHub. Actually, VizHub, if you go to the main site for VizHub, there are lots of templates that are already there. I think some levels require a subscription, but it can help you make these really nice visualizations. But it's worth spending time learning HTML and understanding how D3 actually works. But there is a package in R2D3 for the Star Wars fans amongst us that can make that a lot easier. So it integrates, D3 integrates really nicely with R, but I'm getting sidetracked. I could, like I say, get lost in these visualizations. But you can explore so many different factors of how things have changed over time as well, and looking at these different metrics from 1990 to 2021 to see how things have changed over time. But there's also, for each of the different conditions, there are fact sheets that will describe more information about the condition. So I think maybe just we could have a look at air pollution since we've just looked at particulate matter. And what you get for these fact sheets are a summary of the condition or the environmental effect that might be causing a disease or illness. Give an overview of that, the definition of the actual thing. So here, particulate matter 2.5, how it's caused, and then some summary data, lots of really interesting information if this is an area that you're working in. But there are many others, so many other fact sheets that exist, and some really nice maps that highlight specific areas and areas that could be focused on for policy interventions. So it's definitely a site that you could spend quite a lot of time just exploring the data and the information. And then just having a look at the data catalog. So this is how you start to get into the data, GBD 2021 data through the Global Health Data Exchange. And if you go to the GBD results tool, you do have to register to download. So a little pop-up will appear saying, you know, if you want to, this is what we have. If you want to access the data, you need to sign up, you need to register. If you're doing anything with a commercial financial benefit, then you need a commercial license. But for other uses, for these purposes, academic or teaching demonstration, the data are available for free. So that's sort of how you, and you can explore all different types of data, you know, the things that you can see in the VizHub, the visualization tool, you can access the data and view it here, or you can download data for your own purposes to do the work that you need to do. So looking at an example of from the book. Now I couldn't get the GBD get data function to work, and I don't think there's anything wrong with the function. I don't know if it's just something with my own setup, but I had to download the tuberculosis incidence rate data using, you know, what I call the old-fashioned way. I used curl. I'm on Linux, so I used the curl call, and then I also couldn't see in the documentation how to do multiple locations, so I just did one at a time, downloaded them, and then just combined them into a data set as a data frame, so that I could then view the data, had a look at both sexes for tuberculosis, and created, you can see there's 3 countries, United States of America, Tonga, Italy, looking at the incidence of TB, a mean estimate of incidence for TB, and looking at creating a horizontal bar chart. This is a really nice way to reorder your categories based on another variable in your data. So I'll show you what that does. So reordering the location name based on the mean estimate. So you can see here that from the GBD data, what we've got is Tonga has a much higher mean estimate of TB incidents, and it's much greater than Italy or United States of America. And it's a group of small islands, many of which are uninhabited, but the geography makes it difficult to get resources and equipment in. It's also sort of locally the infrastructure to manage TB and TB outbreaks is limited compared to Italy, United States of America. So you can see the kind of difference that health infrastructure makes. And last week we saw some of the stats around malaria. Absolutely, appalling that there are a high percentage of children dying from a disease that is preventable, treatable. There's really no reason that that should exist in the kind of world we live in, as we're hurtling towards more billionaires and potentially trillionaires. So, it sort of shows some of the disparities and the challenges around managing diseases like tuberculosis. It's a terrible condition. And vaccination can massively help reduce that. Where people can be vaccinated, some people can't because they have a reaction to the vaccine, but many people can get the vaccine, and it works really well where there's infrastructure and resources to do so. So a lot of these sorts of things, I mean, this is really my area of work, social determinants, quite a lot of these, or wider determinants of health. So things that impact on people's health and well-being, but are not directly clinical or medical kinds of effects. So it can be, if you're born into poverty, that obviously has a serious impact on the quality of your life and the access to resources for diet, exercise, access to medical facilities, geography, where you're born in the world. If you're born in a place that has access to medical facilities, that has access to good food, well-resourced, good governance from leadership and political sphere, then it's going to improve your outcomes, but also the choices that people have available to them. Some people don't have the right choices available to them, so they do the best they can. And there are all these things sort of combined together in different ways and really influence how people grow and develop, and the kinds of conditions and diseases or disabilities that can affect them in their lives. And then there's a data set from GBD. As I mentioned, you have to register for GBD. I couldn't actually download this data set. I think I'm still in the queue for it because I couldn't find it anywhere else to use it. So I've kind of cheated a bit, and I've had to do a screenshot from the book. But be mindful that if you are trying to access fairly large data, that it can take a while to get it. So plan ahead and make sure that you register and get that process moving quite quickly. But the categories of the data, so the time span 1990 to 2021, and looking at females, males, and both together. The locations that are available that were picked, the Sustainable Development Index, low, low to middle, high, middle, and high, and the range of values that exist within the data. So I'll just skip past to the final chart that shows over time. So be mindful that the y-axis has been allowed to vary according to the data set. It shows the differences between males and females and both together, and the years lived with disability due to injuries across countries with different Sustainable Development Index levels. And what that does, these sorts of comparisons can help you identify differences in injury-related health outcomes and can act as an aid to understand better interventions, policy interventions, making sure that employers, for example, provide safe environments at work and provide PPE. And I know people often, it's certainly in the UK, get frustrated with health and safety measures, but all of these things have been brought in to stop people getting injured and ending up with disabilities that are quite preventable. So high SDI countries, so more developed countries tend to have, the rates of disability have declined quite substantially over time compared to low and middle SDI countries. And again, some of those effects are due to better health infrastructure, preventative services, legislation around health and safety to reduce injuries at work and to hold employers accountable. And some of those things may not exist or may be in development in some of the low or middle SDI countries. But it just sort of, these kinds of tools and data sets allow you to really start to very easily compare across different types of countries. And rates for females are overall lower than for males. And I think a lot of that is because traditionally men have predominantly worked in construction or more dangerous fields than women, and maybe more susceptible to being at risk of injuries. Although that's sort of changed in many spheres where women and men are working, perhaps we've become more knowledge workers, although those manual jobs and trades still exist. Finding a tradesman to do anything in where I live is impossible. So you have to get very good at DIY, which could potentially increase the risk of injury to me. But I will not dwell on that. But it's just an example of another set of very rich data that you can use. And again, because I couldn't access the data, I've gone with a screenshot. So looking at different types of injuries, you can look into the types of injuries that might happen to people. So in the GBD data, in the visualizations that I started to get lost in, here's the tree map. So it's basically, you can do the same thing in R with the tree mapify package, download your data and look at nested categories or hierarchies of data. Tree maps are really good for that. And you can see quite quickly things like across each of the different types, low, high, and middle SDI countries, similar kinds of injuries, motor vehicle, road injuries, other exposure to mechanical forces, pedestrian injuries, cyclist road injuries, that sort of thing. But it's another way to very quickly see and compare across different places, and then you can really start to dig into areas that you can see, oh, that's interesting, what's happening there, which is really useful for policymakers to get those quick, impactful messages. And going back to the GBD data, to have a look, if you wanted to have a look at a global for disability adjusted life years for all countries, using the GBD data set, creating your own map with a nice Viridis package, which is really good for people who may have colour blindness, colour vision deficiency, because you can see the whole spectrum of colours. Creates these really beautiful maps of the world, and you can see the rate by country per 100,000. The paler colours are a higher rate than the darker purple colours, which are lower rates. So again, it's whether you're working at a national level or a regional level, the same sorts of data may exist for your country or territory. So it's quite a nice way to present information and look at how disability varies from one sort of region to another or one place to another. And just to finish up, really, I think these types of data sets that exist are, as mentioned at the beginning, they can provide really useful comparisons for health metrics across different countries, and how different nations are affected by different types of disease or different types of conditions or environmental effects that can contribute to poor health, disease burden, health outcomes, and can be really useful for policymakers if you tailor your message in the right way, and also for informing populations, for communities as well, to inform people about kind of key things in their area. The fact that we have an intervention in my local authority around particulate matter, like the School Streets project. School kids absolutely loved it. And one of the comments that they gave about the project was they felt cared for. They actually felt as though this was something that the adults in their life that the local authority was doing demonstrated that they actually care about their well-being, which I thought was really quite impressive. And we need to do more of that. And so I think we've also got community consultations around things that concern them, matters of interest. Crime and safety is a big one. Perceptions of safety, perceptions of crime, and those sorts of things. And it's a really useful way, if you present it right with different communities, to discuss matters of interest around health and well-being, and demonstrate that you're actually trying to do the right thing to support populations. Cross-border collaborations. I've just started getting involved in some European projects, and I always find it really exciting to find out what other people are doing in other countries, in other parts of the world. There's a lot of good stuff happening, and there are lots of challenges. And I think this is where pooling ideas and resources can really help. And certainly having access to these data sets, these massive resources that are provided for free for academic purposes, research purposes, for non-profit purposes, really, really powerful tools that we can use if you know how to wield them. But also you can dig into more local effects and say, well, let's look at a national level, look at a regional level, which is what I do spend some of my time doing with these data sets, trying to look locally, but also saying, well, here's what's happening elsewhere in a sort of comparative region or similar kind of population, similar dynamics. So I think I'm going to stop there, and thank you very much for listening.